Okay, so everyone, as you are, having questions, because this is going to be a pretty informal discussion. It's something that we haven't really done so much here, but we are really looking forward to it. We have some amazing folks who have volunteered their time to talk about what's going on in their states, within their centers, and federally and statewide funding through CCDBG and all the others, also universal pre-K. So I know this is a very hot topic, and we're trying to find ways to come together and advocate the best that we can for this essential industry. So with all of that, I'm just going to go ahead and hand it off to Cindy Lehnhoff, who is the director of the NCCA, to kick us off.
All right. Well, welcome everybody to our webinar. And I'm going to welcome those that are going to watch it at their leisure when they receive the recording of it, because we have several people that do that. We are going to be discussing today how we can work together to solve the childcare crisis. And, I don't think anybody at this point questions that there is a crisis. It's my goal and the goal of our panel of experienced advocates to help you become a voice that can help childcare business owners and educators get the resources they need to provide high quality, affordable, accessible, and equitable early care and education without personal sacrifice to themselves. Before we begin the panel discussion with our experts, I wanted to provide you with some federal updates and media headlines as they pertain to the current state of childcare in our nation. In doing so, I think you will note that this conversation is far and wide, from coast to coast, and it definitely is continuing well beyond COVID, when we were finally recognized as an essential workforce. So I'm going to ask that Mariah switch the screen so that the individuals on board can even watch the words, and we'll send this out afterwards. The federal highlights for childcare in 2023 include that the childcare development block grant was increased by $1.9 billion, or 30% over the prior year. It should be noted that this is the second largest increase in discretionary funding in the history of the childcare development block grant. This means that your state has received 30% more funding for this year, 2023, than they did in 2022 to support the block grant. So for your state share of the increase, and it is an estimate, it could be a little off. You'd have to get the exact amount from your lead agency. Please see the link that we posted in the chat. So when the subject comes up that the state doesn't have any more money, and it will come up in some states, that's not true. There is more money that is tied to the block grant, which directly helps states provide more spaces and or more reimbursement for children receiving block grant funds. HHS, House and Human Services at the federal level, which is where child care, early care and education fall under, is launching a new National Early Care and Education Workforce Center. This is a $30 million investment to help identify approaches to increase compensation and advance the workforce, improve career growth opportunities, and enhance the recruitment and retention of a qualified and diverse workforce in ECE. I think it remains to be seen how this group operates and what will come out of it. I'll be following it closely and letting you all know, if there's an opportunity for us to weigh in. Child care development block grant ARP funds from the stimulus packages, are still available in many states that have not utilized them. or utilized all of them, but they have to be liquidated and used by September 2024. So it does bear the question, to your lead agencies if they have utilized all of that money. And then there's the child care stabilization grants that also came from the ARP funds that have to be liquidated by September 2023. If you're looking for any more information about both of those funds, I'd certainly be happy to respond by email or phone call and give more detail. And my information will be in the chat. Okay, next slide. When I think about the state of childcare as it stands right now, I can't help but share a handful of media reports that have been published just in the last couple of weeks. And keep in mind that these come down to me every week from ECEC and First 5 Years funds that are keeping an eye on all of that information for us. Never in our history has there been so much being reported about childcare and the need for it to become more affordable, accessible, and equitable. For instance, from the Washington Post, over the last 4 decades, the cost has skyrocketed in the United States for childcare. I don't think that's a surprise, but just so you know, it's out there, it's being discussed. It now takes up almost 20% of median family income per child in major cities. But the tax benefits some workers use to offset those daycare or nanny expenses has stayed the same since 1986. So a parent can only claim 20 to 35% of their care expenses on their federal tax forms, up to $3,000 for one child and $6,000 for 2 or more. I mean, this is so outdated, and it would be such a great opportunity for parents in middle to upper middle income, to lower their cost by being able to claim more of it. For childcare providers to come away with even the slimmest of profit margins, again, no surprise, they are often already charging families the maximum they can afford to pay. And that is before providers have built in a buffer to cover an emergency, health insurance, and retirement savings for themselves and educators. And that was reported in EdSurge. And then last, the fiscal 5-year fund reported analysis of 2023 State of the State addresses given by governors across the country found one issue in particular that cut across state and party lines: the importance of fixing childcare. The First 5 Years Fund analyzed transcripts from all 35 governors who had delivered addresses by February 13th, 2023, and found that 2/3 devoted a portion of their remarks to the importance of investing state funds in childcare and early learning. And that is definitely, something that you, would benefit from knowing, and we'll share a link later on where you can actually watch a recording of your governor's comments, because that's what he's telling the legislature what he wants. And it's an opportunity for you to camp onto that. Childcare in the news continued. CBS is reporting, again, families across the country are struggling to afford childcare. Fortune 500, with parents facing increased scarcity of availability and rising prices, childcare costs have jumped 25% in the last decade alone, not to mention stricter health policies by providers in outbreaks of COVID, RSV, and regular seasonal illnesses, equating to more sick days. It's no wonder that many parents are putting their careers on hold. And even though Fortune didn't point this out, it's typically women. Childcare crisis. Again, this was USA Today. What costly daycare and few workers mean for the U.S. economy and taxpayers. The pandemic exposed just how broken the country's childcare system is. It costs parents too much and pays employees too little. more than half of the country's residents live in a childcare desert throughout the United States, meaning there are less licensed childcare slots, whether they be centers or homes, than there are children that need them. And I think this is a big one, and one that you should remember in your advocacy efforts, especially with legislators. An updated study from Ready Nation shows the country took $122 billion loss in earnings, productivity, and revenue due to working parents dealing with childcare issues. The same study done in 2018 had a total cost of $57 billion annually. And that was reported by Spectrum Local News. So again, there's a ton of information going out and being broadcasted to increase awareness. Next slide. Again, there are some states that really need a call out, and they're stepping up to help solve the childcare crisis. And this is not only a call out to them, but an opportunity for you to know that there are states that their governors are actively working to support childcare. But then again, you want to make sure that they're supporting it in a way that supports you, the provider or educator, because we can't adequately support parents more than you are supported, because you're the ones that will pass that support on. For instance, the Missouri Governor Mike Parson announced that new grant funding is available through the Missouri Department of Ed and Secondary Education's Office of Childhood for eligible childcare providers and businesses and our community partners who want to work together to expand childcare in their local community. Kentucky just announced that bills making progress on childcare public assistance to support the workforce move forward. As Kentucky continues to struggle with the workforce issues, the General Assembly advanced 2 bills through committee Thursday that will help Kentuckians receive childcare assistance. Oregon, the state senator just approved a measure allowing daycare services in rental homes. Some of you may think that's a great idea. Some may not. I think there's some debate in it, but as long as they do it responsibly and hold the rental home individuals that are licensed as accountable, that, have ownership, it will increase capacity, which is no doubt what led to this. Wisconsin, Governor Tony Evers said he will give $340 million from his executive budget to childcare counts in an effort to help childcare programs throughout Wisconsin. Vermont just awarded $23 million in grants to support children, families in the early childhood system. And lastly, Minnesota's Governor Tim Walz announced an expansive childcare and education plan that could change everything for families in the state. But again, these are all things, and again, we will give you a link at the end in the chat that can help you, and I see where Mariah just posted it about when your state legislature is in session, that's the time, to get, some answers to how they're doing this. And that's the next slide. What is your state doing to improve childcare for providers and working parents? Again, what's your governor doing? It starts typically with the governor. And if you would like a recording of your governor's address, you can go to www.nga.org to see if they even mentioned childcare, and if so, how. And then as far as your legislature, when is your state in session? For your state's legislative session dates, see the link in the chat, because every state has a different legislative, period of time. And again, this is why we're pushing state advocacy and making sure that you have some information that can help you, which brings me to our panelists, because these are all people that have been doing this for a very long time, and they come at it from different perspectives. First of all, we have Scott from Scott Bright. He's the owner of ABC Child Development Centers in Colorado. And he stays very active as an owner in what's happening in his state. And I'm not going to tell you what's happening because through conversation, he will let us know that. And then, of course, we have Ellen Reynolds, who is the CEO of the Georgia Child Care Association. I know personally from being an operator in Georgia for many years prior to 2016, the efforts, and actually a member of the Georgia Child Care Association for a little while. Ellen has done amazing things to rally the workforce there and also to represent the private providers extremely well and to make and has made great progress. And then last but far from least, we have Jake Stewart. He's a professional child care advocate out of Washington, D.C. He has worked with Child Care Aware of America and the Early Childhood Consortium. And he is going to talk about, that side of advocacy and give us some tips on how to manage some of the politics as far as different states being either red, blue, or purple. So if the panel is ready, I'm ready to ask a couple questions. Are we going to be able to see the panel?
Yes, should be. Let me just, everyone should have their, should be able to. I think we can go ahead and get rid of the screen so everyone can get lined up. Perfect.
There we are. All right. Well, welcome, Scott, Ellen, and Jake. Again, we appreciate your time. I would like to just start out by, asking each one of you to tell us how and why you got involved in childcare advocacy. And if we could start with Scott and then move to Ellen and then to Jake, and we'll just, begin a conversation and see where it takes us.
Sounds great. Thank you, Cindy, and thanks for the opportunity to discuss this incredibly important topic with everyone today. So, as Cindy mentioned, owner of 25 licensed centers. Some of them are school age programs, some are preschool centers, and some are childcare centers, and they all work interdependently. And I've found over my career since the 80s, working in early childhood, that most of our operating boundaries are defined by state and federal legislature. And if we don't step up and provide a voice, a perspective for those legislators as they're developing those policies and those rules, we end up being boxed in to things that may or may not be reasonable and may or may not be able to lead us to a place where we can provide an affordable service for families. And so it's been really important to make sure that we have a seat at the table, we have a voice that's heard, because this all could go a much different direction if somebody doesn't speak up on behalf of childcare centers. And so I kind of feel like I hold the place of the big brother for all of childcare centers around the state of Colorado, and I love to be an advocate and protect opportunities, childcare opportunities for families in Colorado.
All right, thank you, Ellen.
Yeah, hi, Cindy. Thanks for letting me be on the panel today. So I was a lawyer practicing law, doing insurance defense litigation, billing my time in 6-minute increments, and decided there was a better way to live my life. So I actually had been volunteering for a group and ended up going to work for them on child abuse prevention issues. And a couple of years later, I decided to start my own business. And a legislator said, I've got a group that's come to me that I think you could help. And it was the Georgia Child Care Association. But when I started with them 20 years ago, a little over 20 years ago, it was 5 people in a room. And now we are 700 members strong, over 700 members strong, growing over that time. But what was funny to me is, I don't know if any of y'all had this experience, but your parents go through and clean out their stuff and find your stuff and give it back to you. And I actually found an essay I wrote when I was in high school for the Optimist Club that said I wanted to work in childcare and with the the youngest learners, as we now call them. And so apparently this was in my heart from being a teenager, but I'm absolutely passionate about it because I feel like, obviously we know about brain development, and I feel like every child deserves the opportunity to maximize their potential through those first critical years through the work that you as providers do. So it's a passion, and my mom's an educator, stepmom, grandmother, great grandmother. So I come from a long line of educators that are passionate about children getting that education. And so that's kind of how I got into it. And I'm absolutely passionate about what I do.
So one of the things that really resonates with me, Ellen, that you said is it started out with you and 5 people in a room. And those would have been 5 probably owners.
Yes, 5 owners. Mm-hmm.
And I really want to emphasize, if there's anybody on the line that doesn't know where to start, sometimes you're the one that has to, initiate starting. And that's something we'll talk about a little bit later. But again, I think it's a great point. I mean, they grew to over 700 advocates. All right, Jake, tell us how you got involved.
Yeah, thanks, Cindy. Hi, everyone. I'm Jake Stewart, and I actually come at this from the educator perspective. So a little over 10 years ago, I was a middle school math teacher in New Mexico, and I did that for several years. And of course, while I was a teacher, I was exposed to some of the systemic and policy issues that of course plague education. So I wanted to go the route of policy. I did work on Capitol Hill for a few years, but my love was always back to education and specifically early education. Even though I taught middle school, I definitely could notice the gaps in a lot of my students' understanding, gaps that even I, as their teacher, could not necessarily catch them up on because I had to teach the current year's content. And there was so much that I had to go back and try to fill, and it just felt impossible. So I became really passionate about the early years, which led me to Child Care Aware of America. And for the last 5 years, I've been in the advocacy and policy space, both federally and at the state level as well. And I've really found that childcare is actually not exactly like K through 12, public school policy. However, I think a lot of policymakers are trying to force it to fit inside that box. So, where a lot of my passion is to get people to understand how childcare truly works, that it's a diverse network of stakeholders, whether it's for-profit, nonprofit, public schools, family childcare homes. All of these players are so crucial, and to get policymakers to really understand that so that we can really develop these solutions is really important. So I appreciate being a part of today's panel.
Well, thank you all for that guidance and help, because hopefully there are some people out there in the audience or that will listen to the recording later that will think about what each of you have said and the origin. And by the way, if you have questions, please put them in the chat, because we would love for you to ask the panel questions after we finish with their questions, and to see if any of your questions are maybe answered. So this is Scott and Ellen. Can you provide an example of how your ongoing involvement in childcare advocacy has clearly made a difference in your state? Scott.
Yeah, great question. So as some of you may or may not know, Colorado is just rolling out a new universal preschool program. So every 4-year-old in the state will be entitled to free preschool starting this coming fall. When the concept of this idea was developed about 4 years ago, I had a unique opportunity within or as a member of the NCCA board, which is our advocacy board for the state of Colorado, had a unique opportunity to sit down at a table with our governor and talk about our dreams of preschool and how it could be universally available to to all 4-year-olds, all preschoolers in the state of Colorado. This could have taken any number of directions, but because I chose to be involved at that level, I was appointed to this council, another committee, another council as universal preschool was developed. There were some really crucial moments in the development, one of which was, should preschool be administered and implemented by the Department of Education through elementary schools, or should it be in a mixed delivery format and include all childcare providers, whether it be family childcare homes or centers? And my voice in that conversation had a part in the direction that it went. And as legislation was developed over the course of the last year or two, that became a mixed delivery format. And so really proud that we were able to protect childcare centers in the development of universal preschool. And had our voice not been present in those conversations, it very well could have gone through the Department of Education, and all 3 and 4-year-olds in the state of Colorado could have been headed to elementary schools for preschool and right out of our centers. And as we all know, the cost of childcare is expensive. Infants and toddlers are exceedingly expensive, and you have to have those 3 and 4-year-olds in your center financially to balance the entire picture. So it could have had a devastating impact on childcare in Colorado had we not really pushed for that mixed delivery format. So that is one way very recently that had a very big impact.
Well, great job, Scott. You know, about getting in there early and just showing up. Sometimes you just got to be the guy or the gal that shows up. And because I've had similar experiences myself when I was a multi-site leader in Oklahoma, and just showing up and not being the negative person in the crowd, not, you know, just saying this won't work at all, but to say, hey, you know, I'm here to learn and to maybe provide some input, you know, so that we can get the best of the outcomes for all families. So Ellen, what was I know you've had several too. Give us, you know, 1 or 2 really impactful.
Sure. And a couple of things. One, you know, I like to say, if you're not at the table, you're on the menu. And so you don't ever change policy by divesting and moving away from it and saying, no, I refuse to be a part of this. And that's exactly what Scott did. Our version of that would have been when Georgia started its own quality rated system. We had providers that were like, absolutely not, I will not participate. And so those providers had no voice in the say of how things got developed, but we had other providers that were willing to step up and be the guinea pigs, and they shaped it for the better and got rid of a lot of the policies that would have been very difficult and negative for our providers. So Scott is a perfect example of how you do that. And in terms of what we've been able to do, you know, with GCCA just this year. So here's the thing about universal pre-K. So we started it under Governor Zell Miller over 25 years ago. In fact, I think we're coming up on our 30th anniversary next year. And so, of course, there wasn't even the possibility of putting it in public schools back then. There's still not capacity today, but there definitely wasn't back then. And so we've had a mixed delivery. It's spread into public schools more and more over time, but we've had a mixed delivery system for 25 years. But what happens over time is what once was a very well-funded program has now become a loss leader to get the before and after care and to get the siblings, because the state has not kept up with that funding. So this year we've gotten the governor to recommend the second highest investment in the 25-30 year history of Georgia pre-K. He has recommended $35 million to give but he has raised K-12 teacher salaries $7,000 in the 5 years. This is going into his 5th year as governor. And this is the first time a governor has ever included our lead and assistant teachers, most importantly, our assistant teachers. But they have been considered included in any raise that K-12 teachers were getting. And the reason that happened is because when Governor Kemp was running, and this was before the primary, we went in and said, hey, you don't have a childcare policy. And you're trying to attract suburban moms. Well, you need a childcare policy. So they said, okay, Ellen, write a draft of a childcare policy. And so I wrote a dream draft, right, of everything we would want, and of course they picked and chose what they wanted out of that. But part of that was having our Georgia pre-K teachers included in any raises that K-12 teachers got, because when our teachers aren't included, then we train them and then they go work in the public school system, right? It's a constant turnover. And so, and it was a fight. There was a 48-hour period where they had announced the K-12 teacher raises, and they had no intention of giving them to our assistant and lead teachers. So the victories that we're seeing this year to give those raises goes back to 4 to 5 years ago when he was candidate Kemp, where we had, when he started, he was polling at 8%. He was definitely the underdog, but we went to every viable candidate and said, you need an early childhood policy. And some ignored us and some didn't. And so we promoted the candidates that had early childhood policies, Democrat and Republican, so that people knew what they were. And in addition to that, we are getting a 20% increase to operations, which we are far below still a break even. They only fund about 60% of cost, which means we have to go raise tuition on private pay parents. So we're working very aggressively to get this to a break even for providers, but that's just a win this year. We had another win that's a different one, but it took another favorite quote of mine is that you may have to fight a battle more than once to win it. That was Margaret Thatcher. And we had a law that was allowing our Georgia pre-K teachers to collect unemployment for regularly scheduled breaks like winter break or summers, so that as owners, your experience rating would never come down, so that you were paying exorbitant rates for unemployment taxes. And so we went in, and it took us 4 years. We got the rule changed at our Department of Labor. Well, it actually captured the bus drivers and cafeteria workers inadvertently in the K-12 system, which are unionized. They went back and fought it, got the Obama administration ultimately to threaten to pull every federal unemployment tax dollar from the feds going to Georgia, so that the Department of Labor had to reverse their rule, and then we had to go change it by statute. That took us 4 years to win that process. But now they don't get unemployment for those regularly scheduled breaks when they have a job coming back in the fall, just like the K-12 teachers, so that our owners were able to get those unemployment experience ratings down and pay less in unemployment taxes. So those are just a couple of different wins in different, one's more of a policy, but affected your bottom line. The other was, the other is trying to affect the bottom line by forcing the state to pay what the actual cost of care is. So those are a couple examples. Sorry to be so long-winded, Cindy.
That's all right. Florida, we just had Tamika in the chat say, we need you, Miss Ellen, in Florida. You might want to spread your wings.
I'd love to come to Florida.
Okay, Jake, as someone that has had experiences participating in advocacy in multiple states, whether they're red, blue, or purple, please provide our audience with how to be an effective advocate in, all the political circumstances.
That's a great question, because it does look different depending on what state you're in. And I'm going to start by saying a response I get often when I talk about being in childcare advocacy, which is, well, that's great. Who would disagree with childcare, right? It's such a great issue. And I think Ellen's quote about being on the menu summarizes it best. It's not that people necessarily disagree with it. It's about whether or not they're prioritizing it. And if you're not a priority, then you're likely going to receive cuts or even just get level funded, which, by the way, in my eyes is basically a cut because you're competing against inflation. So getting it a priority looks a little different depending on if you're trying to appeal to Republicans or Democrats. And I think this is something we've heard for a long time. But just to kind of explain a little bit more about the different states that I've worked in, you know, in red states, and I actually come from a red state myself. I grew up in Idaho, and then in previous jobs have worked in states like, you know, Texas and South Dakota and others. And I've really found that one of the issues is that childcare is viewed as, you know, it works on subsidies, and subsidies are viewed as welfare. And of course, there's always that, you know, anxiety towards welfare from those states. And the anxiety is often because people believe that welfare means that, you know, people are less likely to work and have less of an incentive to go and pull themselves up by their bootstraps, if you will. Which, by the way, I want to reflect that that's not my own views, but those are things that I've definitely heard before. And I think making sure to describe childcare as a workforce enabler is really important to get them to understand why it's so important. This isn't typical sort of welfare-like policy. This is something that is actually going to enable parents to work. And starting with that is a great way to then get involved with the business community. And many advocates have been actually getting business leaders to come in and actually share their voice for childcare. So for example, in Virginia, they're starting to work with the Virginia Chamber of Commerce, who has become a huge player in the Virginia Promise Partnership. Now, for those of you that aren't familiar, the Virginia Promise Partnership is the coalition of advocates that are coming together to try to get access to high quality childcare for all children by the year 2030. And it's not just early childhood groups that are a part of this network. They really made sure to get business stakeholders involved, and getting the Virginia Chamber of Commerce has been very critical in trying to get Republican members to understand the importance of childcare as a business support, in addition to all of the other news that we've heard. In Texas, just a couple of weeks ago, advocates there submitted a letter at a hearing that was co-signed by over 200 businesses about the need for investing in childcare and expanding childcare in that state. That type of strategy is really crucial because it's bringing in those additional voices that can really help make that case to Republicans that childcare is a key business support and a key workforce enabler. Now, a lot of people assume that you know, Democrats are the easier ones to get because they have a natural affinity towards funding social programs. But I will tell you that some of my biggest headaches in my past experiences have been in left-leaning states. California is a big example where they are moving forward with the universal, what they call TK policy, which stands for transitional kindergarten. Transitional kindergarten is ran exclusively out of public schools. So that means that the 4-year-olds are going to be siphoned off if there's not some sort of countermeasure to prevent that. And as everybody knows, that's going to really negatively hurt childcare businesses. But the most difficult part is trying to get left-leaning policymakers to understand why hurting businesses is a bad thing. It feels like profit has become sort of a bad word, especially among the left, and that the idea of businesses profiting off of childcare is just one that I feel a lot of Democrats have not really squared away. We even saw that in Build Back Better and some of the policy decisions that were made there. And I have found that really trying to get those policymakers to understand that childcare is not exactly like K through 12 as people feel it is, but it's actually more similar to healthcare when it comes to the policy. You have a different types of providers, for-profit, nonprofit. You have a subsidy system that relies on co-pays and reimbursements, a lot of terminology that we see in the healthcare system. But most importantly, your goals to try to get universal childcare or universal healthcare really rely on your capacity. and getting Democrats to understand that, for-profit childcare providers are really critical to the capacity that's needed to get to a universal system, or even just expanding your childcare system. It's necessary. I have seen success in that in Massachusetts last year. Again, a very liberal state with a mostly Democratic legislature. The legislature actually took out a provision that would have added $250 million in relief funding for childcare providers. And the reasoning for why they took it out is because of this concern about that money going to private businesses. And advocates really had to push hard on why that money was needed to preserve the system and to really support those for-profit businesses. And we really had to explain the long-term goal here, which was, again, that capacity piece. And that if that money was not kept, more providers were likely going to have to close their doors, and we're going to have less capacity than what we needed. And eventually it worked. And at the last minute, the Massachusetts Senate added it back in. But it's concerning that it was even a problem to begin with. And so just another reminder that just because it's a Democratic state does not mean you have to do that work to really make sure that this is a priority and that the policy works. And that's the last thing I kind of want to point out. I feel like advocates for a long time have really relied on the message that, we need more childcare funding. And that is true. We absolutely need more childcare funding, but there also has to be additional policy discussions that are included in that. We need to talk about how we're going to get to this vision of making sure that every family has access to affordable childcare. And it's one that needs to include all types of providers. And this goes back to why it's so important that providers have a seat at the table. Because just like with healthcare and the push to get universal healthcare out there, it's the same thing with childcare. If we want to expand childcare, we need to expand the capacity, and that starts with providers. So just a couple of tips if you're ever working with those on the left or the right, and just making sure that you are those talking points are tailored, because it's going to be a lot more difficult if you're using the same talking points for both sides of the aisle.
Absolutely. Great advice, Jake. And we appreciate you putting that out there. I like that term, workforce enabler, because right now is a really good time to, engage the appropriate audience. And again, partnering with your local chambers, because those businesses need employees. We actually at the NCCA partner with a group called Tutras, and that is one of their one of the things they champion is making sure that the chambers are aware of the opportunities for them to help in advocacy. They also are including the HR managers in businesses and encouraging them to help their executive teams understand that a child care benefit would potentially help them recruit and retain staff that aren't available to them now due to the shortfall. So there's all kinds of ways to hit this, but the legislators they hold the purse for how we spend money to support childcare. And the reason why we might be different for both sides of the aisle, but in the end, children are bipartisan, and we have to help them see, how that involves them. I'm going to stop. I got one more pressing question, but I want to see if anybody in the audience has a question yet for any of our panelists.
Hey, Cindy. Just looking through chat, none so far, just a lot of praise towards what everyone has been sharing. But if you do have a question for our panelists, feel free to either raise your hand or share your question in chat so we can get that addressed.
All right. Well, one of the questions I want to just throw out to the audience that maybe they can think about for a couple of minutes while I go back to the panel is what are you doing or can you do to encourage your parents and educators to be advocates alongside you? Just if anybody has something they are doing or, think might work, because again, there's power in numbers and we're going to need more numbers with, the voice. We all know what we need, but, we need to talk about how to get there. And Jake certainly had some great ideas for that when it comes to policy. And we'll probably, have Jake back again to discuss that issue a little further, because a better understanding of that would also help you as advocates. Okay, so starting with Scott, where do you recommend someone who has never involved themselves in any kind of advocacy, maybe other than just, clicking or calling their, legislator, start with being a voice for childcare providers, educators, and families in their state?
Yeah, great question. So most everyone probably on this call has a state association of childcare centers that represents the interests of centers statewide. That is a great place to start, because those folks and those organizations have their finger on the pulse of what sorts of legislation is coming up, what voices they need to have the legislators hear as the legislators are talking about whatever topic it might be and how it might affect childcare centers. And so reaching out and becoming a member of that state association is one of the best and most appropriate ways to get started on that. I've been shocked and surprised over the course of the last year or two at the incredible impact that just a few voices have had on the direction that the legislation has taken. All it takes is just a few people to speak up, raise their hand, submit a comment, or be available for some testimony, and it very significantly alters the direction of legislation, whether it's a pro or con. I think in legislators' minds, if they hear one voice, one opinion, they're assuming that amongst their constituents, that probably represents 100 or more opinions of the same. And so every voice that you can get or put together that's in the direction that you feel is important carries much more weight than you think. So step in and become a member of your state association. That is a very key piece to making sure that you protect your business and your livelihood and the livelihood of the staff that work in your program.
Great advice. That's exactly how I started. And I actually went into the organization kicking and screaming, only because I felt I didn't have time. I was a multi-site manager for a large company. And it wasn't until we had a huge recession issue when the oil industry went under in Oklahoma and Texas. And I had 8 new centers that were failing. And the person that, kept pulling at me to come participate, I finally gave in, because I thought, well, I obviously don't know what to do at this point, because Oklahoma and Texas were they were different than what was happening in the rest of the nation. And nobody really in my home office could, give, advice on how to deal with it way back in the mid 80s. And ultimately, I found myself on, the governor's child care advisory committee, partnership with public schools, because we also had universal pre-K in Oklahoma since the mid 80s. So I definitely think that that's, the way to go. It goes back to showing up and listening. It looks like we have somebody that's raised their hand. So before I go to Ellen, Vickiana has raised her hand with a question.
Okay, perfect. And Vickiana, you've been unmuted. If you'd like to go ahead, you just have to hit that unmute button. All right. Well, whenever you're ready, Vickiana, feel free to go ahead and either chat in your question or unmute and ask your question.
All right, so Ellen, best advice.
Yeah, well, I want
Get
to,
5 people in a room, right?
yeah, I want to echo what Scott said. So many people look at membership dues as like, well, I just can't afford that with everything else I have going on. But it's a relatively small price to pay. And I'm going to tell you something you're going to get out of being a part of your association that you're not expecting right now. You will get networking opportunities to share your issues and your, at least that's the way it works for our board, and for, you know, we're working on expanding to have regional meetings like that, so that you can say, you know, hey, this is a problem I'm having with my, you know, and we actually, to Jake's point, we and it was our agency's idea, kind of renamed our subsidy certificates to scholarships, cap scholarships, because that sounds a lot less like welfare and a lot more like we're helping children get an access to early education who might not otherwise be able to afford it. So I highly recommend you all, there's no original ideas, right? Like take that, copy that, take it back to your states and say, hey, let's start referring to these as scholarships for these children, because that's much more amenable to both sides of the aisle. It has a much more positive connotation than welfare, because Jake's exactly right. You know, when you're dealing with Republicans, they may be less inclined to support those ideas. But back to the original question, I really want to encourage you, because, you know, when you say, Ellen, we need you here in the state, well, it takes investment, it takes fundraising, it takes dollars to have someone like me in your state. And you generally, what you start out with is a bunch of volunteers, and the first thing you want to do is get a contract lobbyist. And I can tell you, I was a young whippersnapper just starting my business. When I started, I took the client for $5,000 because I was building my business and I was eager to work on the issues and expand my business. So it was me, 5 people in a room, and $5,000 to get started. And I promise you, I'm not the only one out there in the world who's done that. And it's grown and grown and grown over time. And usually what I always say is, if you can get me in front of people, they then understand why you want to invest in an association and invest in someone to go be your spokesperson, to keep their eye on the issues that are affecting you, to communicate that back to you, and then to help you plug into ways to get involved, like Scott did, like Cindy did. And I promise you, their experience is not unique. To give you an idea, to understand, so many people confuse their state legislatures with Congress and equate the two, and they're very different. Most state legislatures are basically a part-time legislature. They're essentially doing a full-time job because constituents don't stop conveying their needs, you know, when the legislature is not in session. But in Georgia, our legislators get paid a base pay of $17,500, plus they get per diems for the days they're in session, doing work on behalf of their constituents. But it is not a high-paying job. It's not a 6-figure job, full-time job like they have in Congress. So they need people. And in Georgia, like, there's a House and Senate research office, but it's 8 to 10 people to cover 236 legislators. So they need people like us to come and give them the facts, and, you know, and always be truthful, always be kind of, I don't want to say totally humble, in the sense of you're the expert. They don't know what you know, but you do always want to be polite. And I once, we were working on getting rid of drive-through mastectomies in Georgia. I was working on a different client, and I just couldn't understand how the legislature could not support this legislation, right? I was so frustrated. I was a young lobbyist, and I had a legislator say to me, Ellen, have you ever seen that Rorschach ink blot kind of thing, where if you look at it one way, it looks like the old lady, and you look at it the other way and there's a young lady? And I said, yeah. He said, okay, so if I see the old lady, but you see the young lady, who's right? And that is legislation. You can have equally valid viewpoints on the same legislation, and it takes people like you speaking up, and they realize that you're an expert when you are calm and just present things in a factual way and explain to them, while their well-intentioned legislation has some unintended consequences that are going to have a devastating impact on access to childcare, they're more than willing to listen because they know they are not an expert in this area. And once they look at you as someone who's credible and brings them good factual information, they're going to keep elevating you to say, okay, this is a person we need to listen to. And that's how Scott and Cindy kept getting elevated to position after position after position. For example, it's a former board president who's still on our board, Michelle Smith-Lank. She jumped in early on the quality rated process. She was the first quality rated center in Georgia, and she now sits on the children's cabinet with our commissioner and with our governor's wife and with the head of DHS, so that she has input with those folks directly on a monthly basis. So they're absolutely, Scott and Cindy are absolutely right. It just takes speaking up and sharing your expertise. Because I want you to imagine if you, as a childcare owner, got elected to the legislature and you're being asked to pass laws on bills and whether or not optometrists or ophthalmologists should have restricted scope of practice issues, and whether or not the EPA standards or EPD standards in your state should be a certain thing. You don't have expertise in that. But if someone comes to you from that field and is very honest and explains all sides of the issue, you're going to listen to that person, and you're going to go back to that person when you have questions to make sure as an elected official, you're making the vote, you're voting how you really need to vote on an issue. So it's absolutely as easy as investing. And if you don't have an association, which a lot of states don't or don't have a strong one, join a Facebook group, join a whatever, find 4 or 5 like-minded people like yourselves. Now that we have Zoom, we don't have to worry about getting together in the middle of the state in person. Get together and start having calls about how you can influence. And the other point I want to make is, you don't have to know all 236 legislators in Georgia. You just need to know the education committees, and you need to know the appropriation committees that govern your budget. You just need to know the committee. So it's not so overwhelming when you realize it's really a group of maybe 30 legislators you need to get to know, and you start with the chairman of those committees. So when you break it down, it's how you eat an elephant. It's in small bites, right? So it's not as overwhelming when you break it down to those. Okay, we can get 5 people in a room. We're going to divide up the education committee. I'm going to call these 5. You're going to call these 5, and you're going to call these 5. And we're going to try to have a conversation with them about this issue. It's really that simple.
Yes, and I think that's a great idea. We are like 1 minute from 2 o'clock.
Sorry.
But no, that's all wonderful advice, and I wouldn't want you to not, put it out there. We did have a question from Teresa Delamari. She wanted to know how to access the grant money that I referenced earlier that would come from the stabilization grant that runs out in September of 2023 from the ARP bill. Access is going to be different, state by state. And I'd be happy to help anybody.
Start with your state licensing agency. That's who's giving out the money.
Exactly. And in some cases, some states have been more generous than others. What state are you in, Teresa? Well, anyway, again, what Ellen just said is the best advice is your state agency should be able to tell you what grants are available. You can also go to your state agency's website, and typically there is information posted there. If you'd like to email me through the NCCA or at CKLEHNHOFF@NECPA.net. I will share as much information as I can find. And if any of you would like have follow-up questions for the panelists, you can email me them, and I will, they have agreed to, work with me on getting responses back out. We will be sending this out as a recording. It will also be published in our next email, I'm sorry, our next newsletter email in March. And so if you want to listen to it again, I think there's some very valuable advice in it. And I hope you'll recommend others that you know to listen to it, whether it be parents or your educators. Show it to your educators at a meeting. We're
We'll
out.
be fixing that out.
But
No, I'm saying we'll be sure to get that out to everyone. Like Cindy said, this has been recorded. We really appreciate everyone who's come out today, and to all of our panelists, doing amazing work in their states for childcare. These are some repeat faces, so we love to see them here. So thank you all so much. We'll be sure to get this out to you, and we will be contacting the lucky winner of the giveaway. So I will be choosing a name at random, and we will notify you via email, the one that you used to register for today's call. So thank you again for all the work that you do, and we'll be seeing you very soon.
and remember, you're all essential, and don't let anybody tell you different. Thank you.
Thank you.
Thank you. Bye-bye.
Bye.